Monkeypox disease was first discovered in 1958 when an outbreak of pox-like disease occurred in colonies of monkeys in a research center. In 1970, monkeypox disease was first identified in humans in the country of Congo in Central Africa in a 9-year-old boy. Since monkeypox is a contagious disease, it will not only affect the countries in West and Central African regions, but it can spread to the rest of the world. The cause of monkeypox disease is the monkeypox virus. This virus is an enveloped double-stranded DNA virus that belongs to POXVIRIS genus of the POXVIRIDAE family. There are two distinct genetic strains of the monkeypox virus. The first strain is the Central African or Congo Basin strain, and the other type is the West African strain. The Congo Basin strain can cause a more severe disease and is easily transmissible, and the country of Cameroon, which is also found in Central Africa, is the only country where both virus strains have been found. Several animal species have been identified as the natural host of the monkeypox virus. These include squirrels, monkeys, rats, dormice, and other species. The monkeypox virus can either be transmitted from animal to human or zoonotic transmission, or from human to human transmission. Animal to human or zoonotic transmission can occur from direct contact with the blood, bodily fluids or skin, or membranes lining the body cavities of infected animals. A possible risk factor is eating inadequately cooked meat and other animal products of infected animals. On the other hand, human-to-human transmission can result from close contact with respiratory secretions, skin lesions of infected person, or recently contaminated objects. Also, transmission can occur through the placenta from mother to fetus, which can lead to congenital monkeypox. Transmission of monkeypox virus is also possible during close contact after birth. The incubation period or the interval of infection to the onset of symptoms of monkeypox can range from 5 to 21 days, but is usually from 6 to 13 days. The infection with monkeypox virus can be divided into two stages. The first stage is the invasion stage, which lasts between 0 to 5 days and is characterized by fever, intense headache, swelling of the lymph nodes, back pain, muscle aches, and weakness. Lymphadenopathy, which means swelling of the lymph nodes, is a distinctive feature of monkeypox disease compared to the other diseases that may initially appear similar, such as smallpox, chickenpox, and measles. The second stage is the skin eruption stage. The main clinical feature of this stage is the appearance of rashes. The skin eruption stage usually begins within 1 to 3 days after the appearance of fever. The rashes tend to be more concentrated on the face and extremities rather on the trunk. In 95% of cases, it affects the face. It also affects the palms of the hands and soles of the feet in 75% of cases. Monkeypox is usually a self-limited disease with the symptoms lasting from 2 to 4 weeks. Severe cases of monkeypox disease can occur especially among children and immunocompromised patients. Pneumonia, sepsis, encephalitis, and infection of the eyes with ensuing loss of vision are some of the complications of monkeypox disease. In diagnosing monkeypox clinically, the swelling of the lymph nodes during the prodromal stage of illness can be a clinical feature to distinguish monkeypox from chickenpox or smallpox. PCR or polymerase chain reaction, which is also the gold standard in diagnosing COVID-19 infection, is the preferred laboratory test given its accuracy and sensitivity in diagnosing monkeypox disease. To diagnose monkeypox disease optimally, diagnostic samples or specimens are collected from rashes or skin lesions. Symptomatic treatment is provided to patients suffering from monkeypox disease. Antibiotics are given to treat secondary bacterial infections. Tecovirimat, which is an antiviral drug, was originally developed to treat smallpox. The European Medical Association or EMA recently approved Tecovirimat for the treatment of monkeypox. The approval was based on data in animal and human studies. However, it's not widely available yet. Smallpox vaccine can be used to prevent smallpox and it's 85% effective. This is a 2-dose vaccine for which availability remains limited. To reduce the risk of zoonotic transmission, we must avoid unprotected contact with wild animals, especially those that are sick or dead. Cooking meat thoroughly is another way to prevent animal-to-human transmission of monkeypox virus. Another way to prevent the spread of monkeypox virus is through restrictions on animal trade. Some countries have put in place regulations restricting importation of rodents and non-human primates. Animals that are potentially infected with monkeypox virus should be isolated from other animals and placed into immediate quarantine for 30 days. On the other hand, to reduce the human-to-human transmission of monkeypox, awareness must be raised. The main prevention strategy for monkeypox is to reduce the exposure to the virus. This of course can be achieved through observing the minimum public health standards, such as avoiding close contact with infected persons or physical distancing, wearing a face mask, checking of body temperature, hand hygiene or personal hygiene, and vaccination. Thank you very much for watching. Please subscribe to our channel. Goodbye!